So I'm here with Jason and Lisa Coma in Honduras. We're at Loma de Luz Hospital, and thanks for doing this, guys. I just wanted to ask you, just a little bit about your experience here, and maybe you can start by telling us maybe a little bit about your calling here. How did you end up here at Loma de Luz? Because I think that's an interesting story.
So we met Greg and Candy a few years ago at the Global Health Missions Conference, and we first went to Pignon, Haiti, and I've been working in a hospital in the northern part of Haiti there for about 8 months, and it was not a good fit for us, so we contacted Greg and asked him if he knew any other places where we could potentially go. It turns out that 4 of the 5 members of our family already spoke Spanish, so Greg gave us a few options, and we came and visited 2 places, one of them being Loma de Luz, and I liked both places, but I really felt this was the right place for me, and it was also, as an added benefit, it was a great place for the rest of our family, which is a good thing. And it's been that way since.
What would you, Lisa? What do you like most about being here?
I think one of the biggest benefits of being at Loma de Luz is seeing the impact that it's having in our children's lives. Jason and I have 3 children who are 15, 13, and 11. And so we felt like it was a lot to ask them to give up their whole life back at home in the United States and move to another country. But as parents, to see our children thriving in this setting is such a blessing, and to see them learning the value of living out the kingdom call to bring the kingdom of earth on heaven, the kingdom of heaven on earth now. It's been really a neat experience seeing the impact on them.
Tell me, obviously no mission field. This is, I think one of the prettier places that we send people. It's just, and I think that God sometimes sends, should I say, maybe gives the poor some of the most beautiful places on the planet to live. So it's certainly a place of great need, but it can be a place of great beauty too. So I really enjoy coming down here to visit you guys. But no place is without its challenges. What have been your biggest challenges since you've been here?
One of the I don't know enough about a lot of other missionary communities, but there are a number of physicians and other missionaries here that live close to each other, and I think, for me, I don't find the setting to be so challenging, but I would say one of the things that's really been important and maybe challenging is just being with a bunch of other missionaries. Mm-hmm. Greg says that missionaries are like cow manure, that they do great when they're spread out, but they kind of stink when they're all piled together. So I think we have to...
And that was Luis Palau who said that, by the way.
So
not,
Luis Palau
said
that. But I think it also, if we remember who Jesus had in his 12 disciples, he had a tax collector and he had a zealot, and those couldn't be any more opposite. And working through those challenges with other missionaries, knowing we depend on each other and that community isn't an option, it's a must here, I think has been a challenge, but it's also been a growing experience. And so it's been good, and but it's also pushed me to actually be more Christ-like, which I needed that pushing. Sure. So
community living is always a challenge. We came from a background of mercy ships, and that was obviously that's a big community living setting, and that's so I certainly get that. I saw that was a big struggle, and it's hard sometimes. I think you guys, you you live in a fishbowl here to some extent, and that's always in any mission hospitals compound.
Yep.
You do life together, and whether
You do.
that can be really good and it can be challenging at times. Uh, so what would you see as your biggest blessing since you've been here?
Well, I love the work. I love the ability to do everything I think I was made to do in life. And it's a open place. The way Jeff and Roseanne have set this place up really works for a physician who wants to do the best they can with patients and treat patients and see them through. So it's, for me, it's just a blessing to be able to use the gifts that I think God has given me and the desires and putting it all together in one place. So it's awesome.
Yeah, I think knowing that you're a part of a movement of God to bring health and healing to people who otherwise might not have access to that and to this type of care, it's a truly remarkable experience. Very fulfilling.
So how have your kids done here? Tell us a little bit about the kid community here, because I think there are a number of families here. So
Yep. Our kids have jumped right into life here in Honduras. There are a number of other missionary kids here that all live kind of on the same compound. And so our kids get to, once they're done with their homeschooling for the day, they get to run off and play. They run around, they get dirty, they play outside. They're not doing screen time all the time. We don't have to fight about that at all here. Our middle son has started interacting with the children at the children's center a lot. So he's playing with other Honduran kids, learning the language better.
Coming home with Honduran haircuts.
Yeah, he came home one day and was like, I got my hair cut. And he just had lined up with all the other Honduran boys and he got his hair cut along with them. And it was great.
that's awesome. So let me ask you guys, you've been at a couple of different places. Obviously, Haiti was not a good fit, but this seems to be. What advice would you give a new missionary family heading out for the field?
Do a PowerPoint and go to the GMHC conference or GHMC or whatever it's called, the Global Health Missions Conference in Louisville, and go to the breakout sessions on having a family. They'll give you good ideas, and also I'd say don't try and convince a spouse. Let God do that, because then when they go, you know that you haven't just forced them, that they're going willingly. You want a willing spouse, and involve your kids in the decision, which we did. And I would credit one of our children for us staying after a difficult time in Haiti on the mission field, saying we can leave this place, but let's not leave the mission field. That was huge for our kids because I think they know they're a part of the decisions.
That's terrific. Tell us a little bit about how you kind of felt called to missions, and then I think Lisa was a little bit more, a little hesitant about that initially. And how did that all come about? Because you had mentioned the PowerPoint, which reminded me of how you pulled all that together. And can you share that story again?
Well, I grew up saying, God, I will do anything to serve you, except just don't make me be a missionary. I mean, I distinctly remember feeling that way because we had a number of missionary families that were friends of my family growing up, and they would come back and tell their stories, and it scared me. I just thought, I can't handle the bugs and the illnesses that you get, and being so far away from family and friends. And it's actually what kept Jason and I from getting married sooner was a lot my hesitancy of thinking that I didn't know if a life in missions was for me or not. Um, However, we obviously did get married and decided, you know what, God will figure this out for us because we knew we both wanted to serve the poor and underserved. We just couldn't really agree on necessarily where that would be. And when Jason came home from the conference, the Global Health Missions Conference, I think I knew right away that we were going to do this.
Hmm.
But I wasn't ready to say it yet. It took me a few days of kind of just being quiet and contemplating it in my heart before I could have the courage to say, okay, I'll step outside of all of my comfort zones and we can go and serve the poor in another country.
And for me, it was I'm just thinking, like, kind of tearing up, thinking about the image of like a ship that's sunk with a bunch of gold in it. And I feel like the conference like located this ship and was bringing it up. And I was really worried about what Lisa would think about this. And I said, Lord, I've met these neat people, Greg and Candy Seeger, and I've talked to them and I've gone to this breakout session. How am I going to convince Lisa that we should do this? And I had to actually sit and think and not just talk. And I had a long ride back from Louisville to Minneapolis, and I was like, I think I'm going to put together a PowerPoint and some of the stuff that I learned. And then I'm not going to try and convince Lisa, Lord, that's the mountain that you have to move. If you want us to do this, you need to make it happen. And I still can't believe it, but it's great. And I feel like this is what I've always was supposed to do. And to have a wife and kids who will come along is the dream. So.
Awesome. Thank you guys for doing this. I appreciate it.